Okay, so today I'm going to be demonstrating an alternative technique to administering Skinko-E into the skin using a medical device called the turtle pin. And it comes in, we use two different forms. So we use the turtle pin with 19 needles at 1 millimeters depth and 2 millimeters needles with 7 needles onto the tip, and the inside is just like a Lumiere lock normal needle, and that is applied onto the syringe and then injected into the skin. So you get a dual action benefit from this by microneedling the skin as well as then introducing and flooding the extracellular matrix for the overall skin health and also for future proofing from UV photoaging. So I have John here today, and he's just starting to get some concerns around his eyes, as in the skin starting to thin a little bit. So we've decided to do some of the Skinko-E alongside microneedling with the turtle pin, just to help thicken up the tissue and also complement the vitamins and minerals that should be in his skin to help that recovery from the needle injury. And hopefully help produce a few little wrinkles. And also John does have a little bit of pigmentation as well under and around the eye area, so hopefully this will help to lighten that pigment too. Okay John, so we're going to just be pulling tight on your eyebrow here again. It's just so I can get your skin just above the bone there, alright? So we're going to make a start in 3, 2, 1. That's it. With Amy, we've got a very young skin, so it's quite tight anyway, but we still want to place some tension onto the skin, and the actual injection needs to be 90 degrees perpendicular to the skin. So we're going to make a little start just here in the center. 3, 2, 1. And having these 19 needles means that we've got closer injection points, because these are only going to be in the epidermis, which is going to be a much tighter pressure space to get them, so we're not going to actually get as much diffusion into the tissue because of it being more superficial. Whereas if we use the 2 ml syringe, they're further apart because we know that the solution will flood more easily within the dermis. So it just means that we're getting much more coverage into the skin tissue. How are you doing there, Amy?
Yeah, good.
All right. and you will get a little bit that comes out as well. And you can then, just like you would if you were doing microneedling, obviously just layer that over the skin for absorption. But we know that most of it's gone actually into the within the skin. And then press, and then just have a little pause and lift out. Press. So again, we're going to use a perpendicular technique, and we're just going to press and